Hey everyone, welcome to the Get Your Life Together Girl podcast. I'm your host, Danielle Van. As a cognitive behavioral therapist, life coach, meditation teacher, and author, this is your go-to show for a powerful blueprint to personal growth and empowerment, where we dig into the 5 master areas of your life: mental, emotional, physical, spiritual, and financial health and well-being. So if you're tired of feeling stuck and ready to break through the barriers holding you back, whether it's trauma or you simply don't have the tools, this is the right place for you. We're combining Eastern and Western medicine with real, raw, unapologetic conversations to shake up your mindset, elevate your life with new ideas, and help you take action towards becoming your best self. Today, I'm excited to introduce you to a doctor who is transforming women's healthcare. Dr. Monica Minjeur is the founder and CEO of Radiant Clinic, a groundbreaking medical practice that specializes in natural approaches to women's health and fertility. Dr. Minjeur is passionate about helping women understand their cycles, navigating fertility challenges, menopause, perimenopause, and all of the things that impact our physical well-being as females. We're deep diving into what your menstrual cycle is telling you about your health, how fertility awareness methods may be a game changer for you, how conventional medicine often falls short in addressing female healthcare, perimenopause, menopause. We are looking at it all. That's just the beginning. Dr. Minjeur is here to inspire and help empower you take care of yourself and be your own health advocate. So let's not waste another second. The Get Your Life Together Girl podcast starts right now. One big thing that we are focusing on so much for 2025 is that 5 master area practice in our lives: mental, emotional, physical, spiritual, and financial. And one thing that I see so often is women coming in and realizing that the physical body needs as much as the mental and emotional body does. So I have Dr. Monica on with me today. She is the founder of the Radiant Clinic. We're going to be talking about all things women's health, especially when it comes to the menstrual cycle, our fertility, all of the things that we tend to not actually have a lot of education about as women, which is mind-blowing. So one thing that I love so much about what you do, Dr. Monica, is that you teach women to empower themselves. So if you'll just sort of introduce yourself, tell us really what your main area is, and let's start talking about how women can empower themselves, their health.
Absolutely. And thank you so much for having me today. I'm so excited to talk with your listeners today. So, I'm Dr. Monica Minjeur. I am the founder and CEO of Radiant Clinic, and we're a women's health clinic located in Cedar Rapids, Iowa. We do provide telehealth services for women in many other states
Mhm.
throughout the US. But our primary focus is really on helping women to have a better understanding of their menstrual cycles and understanding how their menstrual health can impact their health in so many other areas. So,
Mhm.
working together with women to help improve their menstrual cycles, get back to more natural menstrual cycles, which can then help them not only with any menstrual symptoms they may be having, but also if they're going through fertility struggles to get things back online naturally. And so,
Mm.
really focusing on that education piece: what's normal, what's not normal, how can we teach you how to know when to differentiate that and when you might need some medical intervention?
Mm. It's so interesting to me. I just said just a few seconds ago that so many women do not understand their bodies, whether that is because we didn't get the education from our parents, our grandmothers, this information's not passed down. And there's some doctor's offices that rush us in and out. We don't really ask the full questions. We don't even know what to ask. So let's start there. What's normal in the female body? And of course, every body is different, but what does a normal menstrual cycle look like for most women?
Yeah. So the two things that we look at are, first of all, how often are you having a menstrual cycle? And for
Mm,
most women, we say that should be somewhere between 27 to 35 days.
right.
Now, sometimes that can flux a little, right? Like if I have a 36-day cycle, we're not going to, be alarmed every once in a while. But for the
Right.
most part, 27 to 35 days from the first day of your period until the next first day of your period. So
Right.
that one's a pretty obvious one. And most women can understand that. Lots of women come and chart that. We find that over 90% of high school young women are actually already charting that in some way. So that one's
Mm.
pretty obvious. The one that's less obvious for people, though, and the one that we focus a lot on education here is when am I ovulating and am I ovulating? And that one
Oh,
is a little more challenging as far as tracking that down. And that's part of where our charting instructors come in, is helping you to identify those biomarkers to say, when is my ovulation day? Because if you're, first of all, not ovulating, that can be a sign of dysfunction in your body. And
right.
even if you are ovulating, if the time between when you ovulate and your next menstrual cycle is either too short, too long, or non existent whatsoever, that
Mhm.
can also lead us to say, hey, there's something else going on from a health standpoint. And we really look at that ovulation as another vital sign. So, you go to
Mhm.
the doctor, we check your blood pressure, we check your heart rate, we check your temperature.
Mhm.
In my world, we check your ovulation because we
Right.
know that that's such an important key, especially when it comes to female hormone health. So the ovulation being that other piece that's really important to teach women how to track.
Yeah, let's talk about ovulation for a moment because I know as a mom of two daughters myself, and we are talking about what ovulation, what a normal period looks like, and all of that. There are so many misnomers about ovulation, how long ovulation is, I mean, most of us know what the purpose of it is, but many of us don't realize that there's a very short window in which this happens.
Yeah. So ovulation itself, typically we say, is done and over within less than 24 hours.
Yeah.
I think part of where that gets confused is that fertile window is longer. So
Right.
many women will start to observe signs of ovulation, like, hey, it's coming, it's happening. That can
Mhm.
last anywhere from 5 to 7 days prior to that ovulation event. The
Mm.
other piece is that if you are somebody who is currently sexually active, and you are trying to either avoid a pregnancy or trying to get pregnant, we
Mhm.
know that sperm can actually survive for up to 5 days in the right circumstances if you are fertile. And so,
Mhm.
even though ovulation for a woman is this very short window, this fertile time is open to, typically anywhere between 5 to 7 days for
Mhm.
depending upon each woman.
I love that you pointed that out, especially about the sperm's life cycle there, because a lot of women do not know that. And they become so disoriented when they become pregnant. We start talking about in even therapy, right? These unplanned pregnancies and the life, course shifts that happen. And they're like, well, I didn't realize that. And it's not something that a lot of teenagers are taught.
No, no. And unfortunately, it's, in our world, we target teenagers almost from a standpoint of education, right?
Yeah.
We always say lovingly in our practice, our moms did the best that they could, our grandmas did the best that they
Mhm.
could, but we want to do better for our own daughters. And so,
Yeah.
really saying this is the education we wanted ourselves as teenagers and never were able to find.
Yeah. So, moms, if you're listening and you have, boys or girls, this is something that they need to be aware of. You said signs of ovulation are coming. Can we talk about some of those symptoms and signs? Because, again, not a lot of information around this.
Yeah. So the most common sign that people will see or that women will observe is cervical mucus, cervical fluid, cervical
Mhm.
discharge. And so, quite often in practice, we'll see people come in and they'll say, I think I have an infection. No, you're just ovulating. It's
Yeah.
very, very normal. And so, for women who are tracking this or have an awareness, we typically are going to see that any type of mucus can be fertile mucus. However,
Hmm.
there are signs that it's more fertile. So, a lot of women will talk about that egg white mucus, right? It's really
Hmm.
stretchy, it's clear. It's stuff that you observe even on the toilet tissue when you wipe, either before or after you go to the bathroom. And that's going to be the most accurate sign as far as when your fertile window is and when ovulation is occurring.
Right.
And generally, what we mark that as is going to be the last day of that fertile egg white type mucus. That's going to likely be your ovulation day if we line that up, if we were to check an ultrasound that day. So
Right.
that's the first. The second that oftentimes women will hear about is tracking your basal body temperature. And that can
Mm.
be very accurate as well. The tough thing with basal body temperature is that it has to be checked at the same time every day.
Right.
You can't have had a poor sleep the night before, alcohol the night before, illness, all of those things can throw it off.
Mhm.
And so for that reason, in our practice, we typically don't recommend tracking just basal body temperature, especially if you're trying to avoid pregnancy. But for
Yeah.
people that are wanting to use that as another sign, that can be a really good sign as far as have I ovulated? It doesn't necessarily tell you when that fertile window is. So that's why we use it in conjunction with something else. But when we see that temperature shift, and generally
Mhm.
we say it has to increase by zero point 0.2 degrees Fahrenheit, that indicates, yes, ovulation has occurred. So it's kind of a
Mhm.
retrospective piece. And then the third, the one that's out there that more women have been hearing about would be anything that is a urinary LH strip or a monitor. So
Right.
there's lots of different devices that are out there, lots of different brands of the LH strips. And really what
Right.
this is looking for is an LH surge. So LH is a hormone that is going to increase just prior to ovulation to tell your body release that egg. Now,
Right.
the reason I list that third on the list is because it's accurate only about 70% of the time. So, not
Mhm.
terrible, but also not as good as cervical mucus or the basal body temperature. There's a lot of different factors that rely on that. I have
Mhm.
women all the time that are pregnant and they're like, my LH strips were negative the whole time and they were still
Yeah.
able to get pregnant. So, we say that can be a useful tool for women as far as kind of adding it on and layering it. But again, typically not just a sole marker. So those would be the three things that are primary as far as actually scientifically proven methods. Now,
Mhm.
certainly some women have other signs, right? So some women know I have a significant pain that happens with ovulation. I have
Right.
GI symptoms. I have migraine symptoms. There's a lot of other symptoms that can go along with it. But when we
Yeah.
look at what aligns with what we're seeing on ultrasound when an egg is actually released, those would be the main three is going to be your cervical mucus, your basal body temperature, and then urinary LH metabolites.
Mm. Such powerful information for women, especially because we're not getting this, you know,
Right.
whenever we're sitting in the, sixth grade
Yeah.
conversation or whatever. And moms, you may not know this, just like you said, Dr. Monica, we want to do better for our daughters and their daughters, because if we arm our daughters with this information, then they can pass it on as well. Let's talk a few myths that you have heard or that you know of that can really help women who are either trying to get pregnant or trying to avoid pregnancy right now, or for us older moms that can pass that on to their daughters.
I think one of the big things when we talk about fertility awareness tracking is that there can be this negative connotation is that a lot of these methods were derived from older methods,
Right.
whether they were called natural family planning or
Hmm.
family planning in general. A lot of them had religious ties to them in the past, and a lot of
Sure.
them still do. However, the biggest change is that some of those methods were created literally 100 years ago. And
Hmm.
so a lot of times you may talk to even your grandmother who said, oh, yeah, I used family planning and I had 12 kids. Right. And
Right.
so people get very nervous that they're like, wait,
Hmm.
this is not what my intention is. And so
Right.
realizing that these up-to-date fertility awareness-based methods are very, very effective as far as spacing pregnancies, avoiding pregnancies if that's your intention to do so.
Hmm.
And we have had scientific study over the last 40 to 50 years with many of these methods that show that if you are following the guidelines of those methods, that you
Hmm.
still reach 98 to 99% efficacy as far as avoiding pregnancy, as far as timing pregnancies. And that actually is the same, if not better, than most, oral birth control, IUDs, all of those pieces. And so I think
Right.
the efficacy rate is just one of the biggest myths that we find is people are terrified that like, oh my gosh, I don't think this is going to work. Or
Right.
unfortunately, a lot of doctors still think, even for me in medical school 15 years ago, we were
Hmm.
told family planning is not effective. You're going to get pregnant more than 50% of the time. So don't recommend it to your patients. And that was it. That was the
Wow.
entirety of my medical school career. And this was only 15 years ago, and
Right.
so really when I talk to people about, they're like, why didn't my doctor tell me this? I say, give them some grace. They didn't
You
learn it.
didn't know it.
The
Yeah.
information we get in medical school and throughout our training is
Yeah.
minimal, if anything, and very, very outdated. So I
Hmm.
think that's one of the most common pieces that we overcome with people is this can work. This does work. We have many, many, many women who utilize it long term to avoid
Hmm.
pregnancy if that's their intention. And especially for people as they approach maybe that perimenopausal or menopausal transition, they say, hey, I'm done having kids. I don't want
Hmm.
to be on something hormonal. I don't want to do something permanent.
Right.
But I also don't want to have a baby when I'm 48 years old, is
Yeah.
helping to say, hey, this can still be very, very effective. And sometimes we change up the instruction a little bit. We say, okay, if we tell you avoid intercourse during these days of your fertile window, we may say, and tack on an extra day before and after that fertile window, right? If you are somebody
Right.
who has a serious reason to avoid pregnancy, there are still things that you can do in order to avoid that pregnancy during that time. So
Hmm.
I'd say that's probably the biggest one that people struggle with, and there's so much misinformation out there as far as
Yeah.
efficacy of these methods.
Makes complete sense. Let's move really quickly because you mentioned it. And many of the listeners here are in that stage of moving into that perimenopause and menopause stage. Many women, especially when we start talking about that hormone shift and how it affects the mental and emotional body. So many women are like, I never had anxiety before. I'm like, yeah, yeah, I feel that. Got it. Let's talk about management, those kind of things. But many women don't understand the difference between perimenopause and menopause. And how simple the definition of menopause is. Could you kind of dive into that a little bit?
Absolutely. So it's fairly straightforward as far as the definition. It's a
Hmm.
little more messy when we say, where am I
Sure.
at? Right. So
Yeah.
if we look at the strict medical definition, menopause means I have not had a period for one full calendar year.
Right.
That's it. Perimenopause means I'm still having periods. They may be a little bit more irregular. And I
Hmm.
think a lot of times where the confusion comes in is that you can start to have menopausal symptoms like hot flashes, mood swings,
Yeah.
irritability, all, vaginal dryness, all of those things that can happen even before your periods turn off. And so
Hmm.
that oftentimes is that perimenopause time. Now, depending upon your genetics, your background, your ethnicity, perimenopause for some women can actually start up to 10 years
Yeah.
prior to when your periods finally turn off and we hit
Hmm.
menopause. And so that's oftentimes where we see a lot of symptoms start is when you're, for most women, when you're in your 40s, because
Hmm.
average age for menopause is around 50. And so even in your 40s, you can start to have some of these symptoms. And really, there's two major hormones that play a role when it comes to this perimenopausal time. First is going to be, of course, estrogen. Now,
Hmm.
estrogen, generally, by the time you hit menopause, will start to decrease and typically stay much lower throughout the rest of your days.
Right.
But what happens in this perimenopause time is estrogen is all over the map. It goes high, it goes
Mhm.
low, it goes to normal, and it can be all over creation. And so that's oftentimes where we see a lot of these swings come in, specifically
Mhm.
when it comes to mood, but also with other things like the hot flashes, we call them vasomotor symptoms, are very
Mhm.
estrogen dependent. The other thing that's happening at that same time during perimenopause is progesterone. And progesterone typically, when you are having a normal cycle, is very, very low in the first part of your cycle.
Mhm.
After you ovulate, progesterone should increase. And then if you're not pregnant, progesterone decreases. Now, the reason this is really important is that progesterone is a very calming hormone. And what
Mhm.
happens is as we start to approach menopause, as we're going through that perimenopause transition over time, progesterone starts to naturally decrease. And
Yeah.
so, again, if we don't have that nice calming hormone, that's where we see many women will start to get more anxiety,
Mhm.
sleep problems, and just kind of feeling out of sorts because we don't have that progesterone support we used to. And
Right.
then layer on top of it, estrogen is all over the map and
Yeah.
going wild. And so it absolutely can cause lots of issues that way. And
Mhm.
so part of the strategy is, first of all, educating women that this is normal. It is okay. We're going to get through
Right.
this, but then also working together to say, what are the ways that we can help balance this, whether it's through lifestyle changes, supplements, dietary changes, what are we eating, what's your stress levels like. And
Mhm.
sometimes for women, if it's significantly impactful, it may include utilizing bioidentical hormone therapy, where we say, hey,
Mhm.
let's restore this, let's replace this, let's do this temporarily, let's help ease this transition so that
Right.
you don't feel like it is so intense that it's ruining your life.
Right. And a lot of women will come in and they'll go, I swear I'm going crazy. I'm like, you're not.
Yeah,
I know.
correct.
I know.
Yeah,
And
yes.
correct me if I'm wrong, but at least in the women that are coming in, it seems like that space is getting earlier and earlier. There seems to be happening younger. Do you see that? And if so, any idea as to why?
Yeah, I would love to have an exact answer to this, but
Yeah.
we have a lot of theories. I think one of the big things that we're seeing is first of all, women are oftentimes exposed to exogenous hormones, meaning things like oral birth control and those
Right.
types of things earlier and earlier, right? Like
Hmm.
so many women in my practice, even in their 40s, have had been on birth control since the time they were 14 or 15. And so this
Right.
excess hormone exposure can really cause your body to have dysregulation as far as how well you produce hormones naturally. And so
Right.
I think that's for sure one of the things. I think the other is that unfortunately women, we don't have this switch where we can just turn off our stress levels, and we
Right.
are doing more, we are sleeping less, we are eating poorly, we are
Right.
running ourselves ragged. And when we don't have those supportive lifestyle measures in order to help balance the hormones, our bodies never fully recover and can't get to a point. And so it says, look, we're done, we're tapped out, I have no reserve
Right.
left in order to build good hormone levels in order to have things nice and stable. And I think that's an across the board thing. I don't think that's just for
Right.
women, but specifically when it comes to how we manage and regulate that, absolutely, we're seeing that. Now, the unfortunate thing is that it doesn't necessarily mean that menopause happens and then poof, everything is better, right?
Right.
So some people are just like, if I could just turn off the periods and make everything stable, then it would be better. It's like, no,
Right.
unfortunately, that's not the
Doesn't work that
not the
way.
magic of, yeah, right. You don't arrive and then it's all of a sudden better. So it's one of those pieces where we say if you're still having cycles, we at least have some hope that we can make a difference, that we can change some of these lifestyle things prior
Right.
to heading into menopause. But yeah, we see that in our practice as well, that especially that perimenopause symptoms are starting earlier
Mhm.
and earlier, even in women as young as 35, 37, sometimes in our
Yeah.
practice.
It's amazing to me. You said lifestyle changes, some of the food, those kind of things. So, no matter what stage we are in our reproductive health, whether that is we are still fertile, whether we are in childbirth or moving out of that in perimenopause or menopause, what are some of your typical recommendations? What are the things that we as women should be doing in order to support that overall health?
The biggest thing that I see that women are lacking is sleep. If I
Yeah,
was to say, can we fix one area, it's going to be your sleep. And in general, in my world, we always recommend to our women, ideally, we're aiming for at least 8 hours of sleep per night. Now, that seems ridiculous for some women. They're like, I get 4 and I feel fine. Well, you might feel fine, but your hormones are not happy with that, right?
right.
So, ideally, that 8 hours is what we're looking for. And I think the other big thing that plays a role with that is that doesn't mean my eyes are closed for 8 hours, right? So, we
Yeah.
know that especially if you are on any sort of screen prior to bedtime, it's harder to fall asleep. If you've had increased emotional stress during the day, if you're not sleeping well, if you're not getting to that deep REM sleep, even 8 hours of sleep may not be enough. So
Right.
we talk about a good, wind down routine prior to bedtime, ideally trying to get rid of screens 1 to 2 hours prior to bedtime,
Mhm.
all of those pieces where we said we really want to optimize that sleep. And so sleep is always in my world number one.
Yeah.
The second piece that we oftentimes will talk about is what are you doing for movement? Now, this doesn't have to mean you're training for a marathon or going to the gym for 2 hours a day. And in
Right.
fact, we find that sometimes women are really overdoing it when it comes to exercise, is that
Mhm.
can actually cause increased stress on your body. So, from a general hormone standpoint, we talk about the equivalent of at least 30 minutes of walking or gentle movement per day. And that
Right.
generally is going to be good overall. Now, there's lots of other health benefits and reasons to exercise more or less, and that I totally understand that. But
Right.
in general, from hormone health, we say at least walking 30 minutes a day. And
Mhm.
then food. We cannot have any discussion about health, obviously, without talking about food
Right.
sources. And so the biggest things we talk about are going to be just a general, well balanced diet, but especially when it comes to perimenopause hormones, we're talking about avoiding foods that are pro inflammatory. And so,
Mhm.
whether that means, for some people, we need to completely eliminate or cut back certain food groups, whether that's dairy or gluten or processed sugars or just processed foods in general,
Mhm.
all of those things can make a huge, huge difference as far as your hormone health in addition to your overall health. And so it's
Mhm.
easy for me to just say, like, oh, yeah, sleep and exercise and food, great, fix it, right?
Right.
But really, working with people, educating yourself on what works best for me, whether that's working with a health coach, working through, behavioral therapy in order to institute those changes and realize these
Yeah.
are lifelong changes. These are not just a quick fix and then my symptoms will go away. But how do we
Right.
institute that in a long term, meaningful way is really, really important.
Yes, absolutely. And I love that you just brought into that behavioral therapy piece because when we get to a space that we just don't feel well, everything tends to crumble, which is why we talk about
Yes.
here about those five masters being kind of like the Jenga blocks. If we have them all beautifully stacked, things are going well for us. But if we're not really leaning into all of the pieces, whether that is the physical body or otherwise, things tend to get a little disorienting, right?
Messy.
So, yeah, messy is definitely it. Let's
Yeah.
talk for a moment because there's so many things that can go awry in the female body. But before we talk about things like PCOS or irregular cycles a little bit more, or painful periods, migraines, right? We even see that as we move into menopause and that estrogen lack and progesterone. But talk about best practices for the body outside of some of those, sleep hygiene and food. Where do you kind of see women are lacking there?
I think the biggest is just as far as education of what is normal,
Yeah.
tracking your cycles. I think so many women, especially after they're done having kids, maybe their OB doctor says, "Hey, let's just put an IUD in." And
Yeah.
you know, there's so much out there that says like, "Hey, just suppress your cycle,"
Hmm.
rather than using it as this incredibly valuable tool in
Yeah.
which to say, "How are things going?" Right? Like if my cycles are normal, if I'm ovulating regularly, that's a pretty good sign that my health is doing okay. And so that's another big area that we talk with women about is it's not just about suppressing what's happening. And so helping women to either transition off birth control, remove
Yeah.
the IUD, get to a point of where so many women know or they realize or trying to get towards, okay, I'm eating organic, I'm doing things that are healthy, I'm doing all these things for my body, but I have this
Right.
artificial implant in me, or I have this artificial contraception and hormones that are in my body, and helping to encourage women and help them to realize like, hey, that still is not good for you, just like it's
Right.
not good to eat pesticides and consume some of these
Hmm.
environmentally dangerous things. These other pieces are not necessarily good for you, even if unfortunately, even if they're FDA approved, even if other docs are saying they're safe for you, there are long-term consequences that we see from those things. And so I
Right.
think that would be the other big area is just helping women to understand your menstrual cycle is not a mess. It is not this dirty awful thing. It's a
Right.
beautiful thing that gives us this great insight into our bodies and to say, hey, how can we help if there's something that's off? How can we help to get that back in line, and realizing it's likely trying to point us to something else that's going on that we want to
Hmm.
correct from an overall health standpoint.
I love that. Can we go to the opposite side where menopause doesn't seem like this horrific thing that's happening and we're aging and life is over? Can we talk about that too? Because I hear that a lot where women are like, I have all this pain and I hate this. And I'm like, okay, but there's another side to this as well.
Yeah. So as far as, there everybody's menopause journey is different, right? But
Hmm.
we do see that some women can go through menopause and they're like, "Oh, my periods just stopped and I feel fine," right? Like
Yeah.
that doesn't have to be the story for everyone. And really where we see that big difference or that shift is that we see that women who are focusing on some of those lifestyle changes prior to all of a sudden menopause hitting
Yeah.
can make a huge difference. And so that's why we constantly are telling people, please don't wait until you go through menopause and then you're dealing with these miserable symptoms before
Right.
you try and make a change. Because a couple of big things happen with menopause. Obviously, first is that significant estrogen drop, which can make a huge difference just as far as overall lifestyle, but
Right.
also metabolism shifts quite a lot. And so
Yeah.
if you say, hey, I was previously a bit overweight, or, I was trying to lose weight before menopause, I promise you it's going to be twice as hard after menopause. And so saying,
Right.
let's make some of these changes now, but realizing it's not always this terrible, horrific thing for some women.
Right.
Some women are able to
Yeah.
navigate that gracefully. Now, I will say there are some genetic components to that. So
Yeah.
even if you are somebody who's like, look, I'm doing all the things and I'm still having a terrible menopause, some of that may be genetic. Some of it you can blame mom and grandma, and thanks so much for the genes. But there are certainly pieces. I think a lot of times women are just like, well, this is what I'm dealing with, and they have to sit back and take it. It's like, no, no,
Mhm.
no. You can do things proactively in order to try and make a difference in your symptoms.
Absolutely. One big philosophy that I talk about with all the women that come in, just for the behavioral therapy part, is what we do in our 20s, we pay for in our 30s, and our 30s, our 40s, our 50s, our 60s, and
Yes.
the benefit as well. So be
Yes.
focused on that, ladies. Think about if I'm 40 years old now and I haven't moved into these stages, at least I haven't recognized these stages yet, what can I be doing now, as you said, to shift and be in control of my health, right?
Yes.
Can we talk about PCOS? A lot of people are starting to have some awareness, thanks to TikTok, Instagram, and all of these social media pieces. And I think a lot of younger women are, and even older women are starting to realize I have been suffering with something that I didn't even realize, or even just some of these migraines. What are you seeing and what are your thoughts there?
Yeah. So PCOS, I think specifically is a huge, I mean, we could have a whole conversation just on
Sure.
PCOS. But I think a couple of the big things that we see with PCOS is first of all, I do sometimes see that women are inappropriately diagnosed with PCOS. So
Sure.
commonly this happens if you go in to try and get a diagnosis, you don't know what's going on. And maybe you're on birth control because you were having bad symptoms or you were having irregular periods and you get a diagnosis of PCOS while you're on birth control, I just want to
Right.
let people know that may be artificial because of being on the birth control, right?
Right.
So ideally, when we're evaluating for PCOS to say, is this truly what's happening? We're evaluating you when you are not on any sort of hormonal contraception because that can
Mhm.
falsely give you this diagnosis of PCOS. I think the other big thing is that with PCOS in particular, there are different types of PCOS. There are four
Mhm.
main categories that we recognize, and they're thinking there may be even more. But within those four categories, PCOS is different from person to person. So even
Mhm.
within our practice, I don't have two patients that are on the same treatment protocol if they have PCOS because
Right.
every manifestation is different. So, for example, some women with PCOS struggle with their weight, struggle with blood sugar and insulin resistance.
Right.
Some are very normal weight and have no problems with insulin resistance. And so, because of that, treatment and how we manage those symptoms for each individual needs to be tailored, needs to be very
Mhm.
individualized. And I think the other piece is realizing that PCOS, just putting somebody on birth control that has PCOS is just masking the symptoms. It's
Right.
artificially, letting you think that you're having regular periods, that everything is okay. And in my world, about half of our practice, we work with people who are trying to get pregnant. So dealing with
Mm.
fertility concerns. And many of these women are women with PCOS who have been on birth control for many years because they were told that's the only way to fix it. And now they try and come off of birth control and are trying to get pregnant. And they're like, well, I can't.
You
Like,
can't.
I'm not
Yeah.
even having a cycle. I'm not ovulating. And
Right.
so I think part of that is this realization that we don't have to just put you on birth control in order to repair your PCOS, right? So
Right.
we work with young women, even as my youngest patient right now is 12 or 13.
Mm.
And, when we're dealing with some of these concerns, is this PCOS? Is this not? How can we treat this now so that down the road, first of all, you're able to
Mhm.
identify what's normal, but second of all, that we don't have these additional risks and side effects and concerns of PCOS that are long term untreated because we were just masking it with birth control. So even if
Right.
you're not trying to get pregnant at this moment in time, we want to see that you are ovulating regularly, that we have cycles
Mhm.
that are normal and not just covering it up by giving you hormonal birth control, which is so often what happens nowadays.
I think it's what happened across the board for at least my age group. I'm now closer to 50 than I am 40. It was sort of like, oh, well, you're having this, so here you go, right? So a lot of us tend to recommend to our daughters, right? Like, oh, well, this is what you do if you have painful periods or you're having this symptom or whatever. Let's go to the OBGYN. And usually it's
Yeah.
our OBGYN. So they're kind of older in,
Yeah.
the thought process here. And so I know one thing that for you before we go to these other pieces is, that avoidance of hormonal contraception. I'm going to talk a little bit about that and why that is the thought process.
Yeah. So the biggest thing is, first of all, there is that piece of we don't want to just cover up a problem. We want to
Right.
fix that root cause, right? So
Yeah.
if the root cause of your problems is PCOS, or maybe it's something separate from hormones, maybe it's thyroid dysfunction or
Mhm.
disordered eating habits or
Right.
cortisol deficiency, maybe there's something else. We want to fix that problem because it impacts other health.
Right.
The bigger thing though that I look at long term is that birth control is not without side effects, right?
Mhm.
So it is from a standpoint of being FDA approved, it is considered safe in that the benefits potentially outweigh the risks for
Sure.
most women. But that doesn't mean that there are no risks, right? Like I have had
Right.
women in my own practice that have come to me with blood clots, with cancers, with liver
Mhm.
disease, with all of these things that, yes, they're rare. However, nobody wants to be that person that has any of these side effects, right? And I
Right.
think the bigger one for me more recently is there has been so much data coming out, especially talking about the mental health impacts of
Yep.
women being on birth control,
Yep.
especially when they are started on it when they are teenagers.
Yep.
The teenage brain is still developing. It is still determining how many neurotransmitters do I have to kick out? Where is my
Yes.
balance as far as depression, anxiety, all of those things? And let's be honest, for many teenagers, it's already a time of emotional turmoil. And so
Mhm.
now we're adding this extra layer on where their brains literally are not able to process the neurotransmitters well, which can
Yes.
make impacts long term,
Yep.
even after they are off birth control. And
Yes.
so in my world, that's where we get very, very vocal, especially about not putting teenagers on birth control because of these huge mental health impacts long term that we are only just starting to understand. It's like, no, I do not want my daughters anywhere
Yes.
near that, even if there's a possibility that this increases their risk, because we're potentially setting them up for lifelong struggles in regards to their mental health because of these hormones.
I can't tell you how many mothers have sat in front of me and they're like, "Oh my gosh, my daughter is doing this and this and this, and I just found out she's sexually active. I'm going to rush her to, Planned Parenthood or to the doctor or whatever." And I'm like, "Please do not.
No,
Please don't do
right.
that. Let's educate. Let's give some other ways to, combat pregnancy other than giving them a fake hormone in order
Yes.
to, change the mental health." I'm like, "What are we doing here?" Again, lack of education, lack of
Yes.
education.
Yes. I was just going to say, and I think the other piece would be a lack of somebody telling them that there's a different way, right?
Yes,
So when
yes.
oftentimes when women go to their doctor, the doctors themselves are like, well, birth control is what we do, so
Yeah.
just do
Mhm.
this. And oftentimes there's not that additional piece that says, oh, or there's this other option, right?
Yeah,
So just being able to have the awareness that there are other options available. I'm not saying they're easy, right? Like, but
right.
also when you look at compliance rates with something like taking birth control pill or dealing with those side effects, that's not
Right.
easy either, right?
No.
And so part of this is like education on what can this do to your body long term, but also to say there are other options. There are
Yeah.
other things that we can talk through as well.
And I think that's the important thing to point out is that, ladies, you need to be asking questions. You came to your doctor because that is the person you are entrusting to answer the questions that you have.
Yes.
So if we get in there, and the same for my practice, right? When you're coming in, you need to be asking me questions as well, right? I'm not just
Yes.
there to give you a guideline. That doesn't work for me. Great. Let's figure out what does. You
Yes.
need to empower yourself. You have to ask the questions. And if your doctor is too busy to answer those questions, find somebody else that will listen.
Yes, please. Yes, please.
Yeah. So let's kind of take a side step back to the migraines and these kind of things because we see them no matter if we are ovulating in that stage of life or we are in perimenopause or menopause. Obviously, different reasons, but still because of hormone shifts a lot of times.
Yeah.
Natural ways that we can hit those, in your opinion?
Yeah, absolutely. So, one of the things as we're tracking your cycles and seeing what's going on, if you are
Mhm.
dealing with other symptoms, we can then overlay that onto our charting, right? So, I can see, okay, typically her migraines are happening when she ovulates or right when she's having her period. And that can clue us in to say, okay, what are the hormonal things that are happening during that time, right? So, if
Right.
it's a time when estrogen is naturally surging, is maybe that not working as it should be? Or if it's a time when progesterone should be increasing, maybe that's not enough, or maybe it's not balanced
Right.
enough with the estrogen. So sometimes just the timing of when those migraines really clues us in to say, is there something hormonal going on? And then the other is realizing that migraines happen in all people, not just in
Right.
women, and realizing that sometimes those common things can still be, whether it's diet or stress or lack of sleep. And one of my very favorite comparisons that I make is whether it comes to acne, migraines, anything that would
Mhm.
affect both genders. If you are a 30-year-old guy who comes into me with acne, I'm not going to put you on birth control, right? Like
Right.
that's ridiculous. So
Yeah.
just because you're a 30-year-old woman who comes in with acne, I'm not going to put you on birth control, right?
Right.
Even if some of it may be hormonal, there's something else that's going on. There are other ways to treat those things. And the same would apply for migraines is that we're still going to look at what are all of the
Mhm.
things that we look at from a migraine standpoint. Magnesium is a huge one that's come up. So many of us are
Yes.
deficient in magnesium. And so sometimes it's as simple as getting you on the right dosage and the right frequency of magnesium. And that's not something that's just a woman hormone thing. That's
Yeah.
just a general life thing. And so
Yeah.
looking at some of those basics and going, okay, if there is specifically a hormone shift or a hormone pattern that we see that it's like, look, this is always when my migraines are, absolutely. We want to tackle and evaluate, are the hormones doing what they're supposed to be doing? If they're not, let's get that back on track during that time. And oftentimes that improves the hormonal migraines, but also
Right.
realizing that migraines can just happen for the other reasons that they happen for men as well. And just kind of
Right.
going back to baseline and saying, okay, let's figure out and kind of go back to what are our other treatment options that we have for migraines that don't necessarily include exposing you to birth control, which may or may not actually fix the problem.
Right. Such an important thing. There are other ways. We don't have to go to what we believe is a standard or these standards that have been spread for the last 30, 40, 50 years. There are other options. I think the biggest question that I have for you right now is how can we empower ourselves? Obviously, education is the first one.
Yeah.
And what is the one thing, or maybe a handful of things, that you wish women truly knew?
Yeah. I think the biggest thing with empowering yourself is like you mentioned, the education piece.
Mhm.
And if you are a woman who is having cycles still, you can chart your cycles. It can
Mhm.
seem overwhelming. There are different things you can do as far as certain apps to download to track your ovulation. There are phenomenal teachers and educators throughout the entire world, quite frankly, that all
Mhm.
they do is help teach women how to chart their cycles. So I think that is step number one, because that will help you to then identify if there are symptoms you're having, are they hormonal or not? I think a lot of times we
Mhm.
women just say, okay, well, it must be my hormones because I'm a woman and I'm hormonal. Like that's
Right.
maybe true,
Maybe
but also
not.
maybe not fair, right?
Right.
So I think that would be one piece. And then I think the other would be just from a standpoint of helping to educate other people, right? So maybe you are somebody who
Mhm.
already knows this or who's already doing this. There are people in your world who still don't know this.
Right.
There are coworkers, friends, nieces, cousins that are struggling with either menstrual symptoms, with infertility, that don't know that there's a better way. And so,
Right.
really helping to spread that word, especially as women, we are really good about talking about stuff when stuff hits the fan, but we
Mhm.
also need to be sharing this message of hope that there is this better way forward. And then I think the final piece, and you had kind of touched on it already, is that if you have a healthcare professional who either doesn't get this, who pushes against it, who doesn't give you the time of day, please find a different healthcare professional. There are
Yeah.
people out there who understand these things, who are willing to listen. I always lovingly joke I would rather have a neutral doctor rather than somebody who is saying, no, this is bogus.
Absolutely.
But at least to say, it is okay to
Mm.
question your doctor. Please do. Like, if
Right.
they give you any sass back and have a inferior or a superiority complex, find a different doctor. Like, we are
Yeah.
humans, we can't know everything either, but it's
Yeah.
really important to work with somebody who has that time to sit down and explain these things to you. And sometimes it might not be a physician. Sometimes it might be a different healthcare professional. Sometimes it might be
Yeah.
a therapist, a counselor, a coach, somebody else
Mhm.
that can talk through these things with you to say, I give you the support, I give you this permission to seek out these other ways, because
Mhm.
ultimately at the end of the day, even though I know a lot about this stuff, I don't know your body as well as you know your body. And so being able to speak about what's going on and share that in a way that is mutually beneficial, that we can both get to that common goal, is
Mhm.
so important. So please don't be silenced. Please speak up for what you know is
Yeah.
best about your body, and find a healthcare professional who is able to work with you and make sure that you guys are on the same page as far as your personal goals.
I love all of those things. One of the major things that I always tell every person that comes into my office, just because this is the way it's always been done doesn't mean it works for you.
Yes.
Period. Right? You
Yes.
mentioned being able to see people in other states doing it, I'm sure, via telehealth. Can you tell us how we can find you? Tell us the different ways that women who are just in need of this natural, focused healthcare can connect with you.
Yeah. So probably the easiest way is through our website, which is radiantclinic.com.
Mm.
And on that website, you'll find all of the ways that you can keep in touch with us. I do have a podcast as well called Cycle Wisdom, where I do just short episodes where we talk through, different menstrual cycle concerns, fertility concerns. We have a lot of episodes even where we talk about menstrual health and mental health and how that
Yeah.
overlays. And then I also have the ability on that website to book a free discovery call with me. So if you're
Mm.
looking to say, hey, is this service right for me? Is this what I need? Then you can just book a free call with me. We'll talk through if this service is right for you, or if there's
Right.
something else that I can point you in the direction. So as far as charting instruction, our charting instructors are able to teach people charting instruction throughout the entire world. There's no limitations on
Beautiful.
that. As far as if you are needing additional medical assistance, I do have a medical license throughout many different states across the United States. And if I don't have a medical license in your state, I have colleagues across the country who I'm happy to put you in
Right.
touch with. So you can always just reach out and contact us and say, hey, I'm looking for somebody in this particular state, and I'm happy to put you in touch with that person if it's not something that we can directly help you with.
Beautiful. I think the biggest message that both of us want to really put out there is another way, and
Yes.
you do have the power to give yourself permission to own your body. What's happening in your body is natural, it's beautiful, and if you need a little bit of support and help, it's there for you.
Yes.
Yeah,
Absolutely.
absolutely. Yeah. Any final things that we missed that you want to add?
I think the biggest message is just like I mentioned, that message of hope is that,
Mhm.
there's so much. I think women can get very discouraged with conventional medicine. We can, be all ready and go to the doctor and think we're going to have this great conversation. And you look at your watch and you're like, they spent 6 minutes with me. How did this
Yeah.
happen? Is just to realize that, there is hope. There is a way forward that is better. There are
Mhm.
healthcare professionals that are trying to do their best, and there are some that are able to spend more time with you. But not to be discouraged and not to give up
Right.
hope, even if you have poor experiences every now and again. But there are better ways forward. There are people who are willing, able, and wanting to listen and to help. And so sometimes it takes a bit to find those people,
Yeah.
but please don't give up hope. There's always a better way forward.
The complete message of why I do what I do. Beautiful.
Yes.
We end the podcast the same every time, and I hope that you'll indulge us. And it is asking you, what are three things that you are currently grateful for?
I am so, so grateful for my ability to be able to balance my work and my life in such a
Mm.
way that I get to serve the patients that I do on a daily basis, and I get to spend time with my family. Part of the reason that I founded this clinic in general was obviously to help women and to serve my community. But I also wanted to do it in a way that honored my family and had
Mhm.
the time to be with my three young kiddos at home. And so I
Yeah.
am so grateful for the ability to do that. I am grateful for my staff, for my team, for my community, because this my current clinic, even though I've been doing this type of medicine for the past 12 years, my current clinic is only a little over a year old,
Mm.
and we have just been able to flourish and take off and really, really grow in our community, which has
Yeah.
been so amazing to pull together so many wonderful people.
Yeah.
And then I think the third would be is just I have colleagues that do what I do throughout the entire world, and I am so grateful for the ability to be able to speak openly about what we do.
Right.
I have doctor colleagues in other countries who cannot speak about what they do. They have to,
Right.
keep it very under wraps. And so the ability to be able to educate women to speak on platforms like yours, to be able to really be out there in the world and in social media and
Mhm.
really be able to spread this message of education. I am really grateful for that because I know that's not the case in all places. So I'm so grateful for the
Mhm.
opportunity to be with your guests today, and to be able to share this message of hope.
Dr. Monica, what an honor to have you here to be able to share your knowledge. And ladies, take command. There is hope. Reach out to Dr. Monica or have, her staff help you. The truth is, we sometimes miss things. And if we can just align body, mind, health completely, we will feel better and then live a happier, more together life. So thank you, Dr. Monica. It was such a pleasure to have you on. Appreciate it.
Thank you, Danielle. Take care.
Aren't you walking away feeling so empowered to be able to take care of yourself in the way that nature really intended and being able to understand your human form? I can't thank Dr. Monica enough for coming on in that great conversation. If you've enjoyed these tips for bettering your life and aren't already following me on social media, please do so at Get Your Life Together Girl on Instagram, TikTok, Facebook, YouTube, Pinterest, and even on Insight Timer. Speaking of Insight Timer, join me live every Monday morning at 9 Central, where we talk about different conversations just like this one. And you can ask questions live. It's a growing community there. If you're looking for other resources, hit up my website at getyourlifetogethergirl.com. You're going to find downloads, a blog, even a merch store. So much to uncover there. If you are interested in working with Dr. Monica or looking at her resources, go to her website, radiatclinic.com. You can find different ways to connect with her and, of course, book that call to really empower yourself. We'll put all the information in the show notes too, and a direct link so you can go right there. I can't thank you enough for being such a valuable part of this beautiful community. Please leave a review, as it does help others see the Get Your Life Together Girl podcast. I hope that you have the most beautiful day. Until next time, be kind to yourself and others.